So that statins to some percentage of cases may increase the HDL cholesterol, but to a greater extent, most of the time they are just decreasing the bad cholesterol, but they are not much increasing the HDL. So it is basically onus is on us to increase our good cholesterol by increasing our level of physical activity. Plus, at the same time, we should also address the risk factors like blood pressure, diabetes, and obesity. So this also has to be kept in mind that we have to address these risk factors also, because unless until we address these risk factors, we are not going to increase our good cholesterol. And as I told you that by increasing just the level of physical activity, we can reduce all these risk factors. Like our BP will also start getting controlled, our weight will also start getting reduced, our diabetes will also get under control, and therefore the HDL cholesterol will also increase. Initially, we doctors basically used to prescribe the red wine also for the HDL cholesterol, because it used to contain some resveratrol, which is an antioxidant in nature. So this chemical was found used to be increasing the HDL cholesterol. But in the Indian scenario, we don't prescribe much now these days, because Indians have a mentality of binge drinking. Means basically they don't take alcohol. They take alcohol not as a medicine, but just like as a binge drinkers, just for a fun. And besides it, in addition to alcohol, they are consuming a lot of basically fast snacks, a lot of salty foods along with it. So it is not going to basically benefit, rather than it is going to be harmful. And therefore, best treatment for HDL is just the physical activity. Then regarding the bad cholesterol, so for bad cholesterol, I told you initially the diet and exercise can play a very definitive role, and therefore it depends upon the level of the cholesterol. If the cholesterol is not alarmingly high, like if the triglyceride is somewhere 150 to 175, LDL cholesterol is somewhere between 120 to 130, 140. So in such scenario, I also encourage that such patient may follow a strict diet lifestyle modification in terms of dietary modification plus the increase in the level of physical activity. So they constitute the part of lifestyle modification. So increase in the physical activity, then 30 to 45 minutes of walk 5 days in a week basically is the level of amount of physical activity he requires. And in the dietary regimen, basically cutting off extra carbs, carbohydrate diet, sugars, fast foods, consume lot of fresh fruits, vegetables, uh, avoiding dairy products, and basically include lot of nuts in the like almonds and walnuts, not the cashews, because cashews contain good amount of cholesterol. So in the nuts, basically, if somebody asks, so everybody starts consuming cashews.
एग्जैक्टली क्योंकि वो सबसे
So
टेस्टी भी है
yeah, yeah. So cashews are sometimes you can take, but not as a routine. But almonds and walnuts you can take daily. So they are having a good amount of antioxidants, omega fatty acids, which are very good for bringing down the cholesterol levels. Then among the fruits, basically the third question was about the fruits. So any fruit, unless until you are diabetic, actually, in which some sweet foods you have to avoid, like papaya, mango, chiku, grapes, and those even diabetic patient can consume apples, pomegranates, jamun, guava. So apart from that, if the person is not diabetic, then any fresh fruits and vegetable are equally good to bring down the cholesterol level, because each and every fruit contain a lot amount of calcium, apart from minerals, vitamins, calcium, some various antioxidants, which are very important in bringing down this cholesterol level.
Okay.
Then the fourth part was regarding the fourth question was.
तो fourth question was, does calcium increasing calcium
Yeah.
take increase your calcium score?
Yeah, actually, it is a misnomer actually because calcium is equally good unless until you are in overindulgence in calcium ingestion. So you should get your calcium done. If calcium is low, then only you should consume calcium. Otherwise, do not take calcium because anyway, calcium, extra calcium can cause problem.
अच्छा
It
तो
can,
मतलब
it
जो
can.
कैल्शियम हम डाइट से मिलते हैं वही काफी है कुछ
वही काफी है and if on a routine basis routine test and if you are feeling very weak and on a routine test you have found your calcium very low or vitamin D very low, in that scenario you can have some calcium for a certain period of time and then get basically calcium check maybe after 1 month or 2 months of the supplements taken. Do not take it on a long basis, prolonged basis because it is going to harm, because then it is going to harm your kidneys because it is mostly excreted to the kidneys, so it is going to harm your kidneys, then it is going to get deposited in the area where it should not deposit. So basically, but it is usually a misnomer that taking extra amount of calcium will go on depositing unless until you are taking very high doses of calcium.
एक और क्वेश्चन आई मीन one important question is of course causes and symptoms of heart attack. लेकिन उससे पहले I do feel that this is an important question. Mr. Ajay Agarwal पूछ रहा है कि what is your suggestion on all these Herbalife network type products for healthy heart?
See, Herbalife network are totally basically uh, market bound, basically marketing strategy. Because most of the time we have found that they have not caused much benefit, rather they had caused harm.
अच्छा तो
So,
ज्यादातर वो harmful है.
yeah, so because a lot of protein drinks we've found in the shelf now, instead of people consuming cold drinks like Coke or Fanta or Maja, they are consuming the protein drinks. So these protein drinks are not actually good because they're causing harm because they create a lot of ketones inside our body and those ketones are very harmful. So these herbal-based products are totally a misnomer, I would say, because they may just work as a placebo in which person may feel good for a certain period of time, and once he leaves, because they are not going to consume for lifelong. So once they leave, then they start basically again having the same problem, and because also having the side effects of those things which they have consumed. So to me, I think just adherence to a good lifestyle in form of basically good amount of physical activity